3宗個案。
6 units, because a lot of the cases have been sent to quarantine centers or hospitals with symptoms. There are 6 units with additional cases. For Ying Kwai House, 71 cases altogether, including confirmed and preliminary positive cases, an additional 8 cases involving only 2 additional units. For Yak Kwai House, there are altogether 126 units affected. Ying Kwai House, 44 units affected. Nga Kwai House, there are 2 additional cases, but no additional units because these cases are family members. Ha Kwai House, no additional cases or units. Currently, 13 people and 5 units. Yuk Kwai House, an additional 1 unit. Now altogether 3 units are affected. For that additional unit, the person was identified under the compulsory testing. Ying Kwai House, 2 additional cases, but they are close contacts and sent to hospital from the quarantine center. So altogether, there are 58 additional cases. So altogether, 334 cases. Most of them are related cases. Of the related cases, let me give you some more information. There is a mini outbreak that have been identified. The warehouse of Mannings. There is an additional case. There are altogether 4 cases. For the Chunwan security guard, initially there was 1 from Yak Kwai House, and there are some staff members that are now confirmed. Altogether, there are 5 security guards in that residential complex at City Point. 4 confirmed cases and some preliminary cases. In Choi Wan Estate, Changpo House, there is a security themselves. They often go to Lion Rise shopping mall in Wong Tai Shin, in a restaurant Hak Mun Ting on the 1st floor. Previously, there was 1 case who worked there as a lift or elevator repairman. Is 13282. It's an unlinked case who worked there. It might be related. They are all Delta cases. And for the lift repairman, he's used the toilet there. So did these 2 people. For the Lion Rise shopping mall, if people have been there, they will have to undergo compulsory testing. We have already made an announcement. For Aeon in Chun Wan, there are also some cases, currently 5, including some clerical staff members, some in the food court, some from fish store, and some from grocery stores, as well as security guards. Initially, there are 2 people living in Yak Kwai House who work there. And there is someone from Yak Kwai House who's been to Sei Guai Chan Tang. A lot of the residents have been there. It's a confirmed case now. That person also worked at Fei Canteen on the 6th floor of an industrial building. There is another case related to this place. For Kwai Hang Yun, which is a food trade company, there are 3 cases. Some people from Kwai Ting Estate work there. There is another confirmed case. First block, Tropicana Gardens, block F. Previously, there was one in block E. There is a ventilation shaft, maybe there is some contaminated air flowing towards the other direction. For Block F, those living on the 6th to the 8th floor, they will be sent to a quarantine center because they might have been exposed to the virus. There's someone working in Cheung Sha Wan, actually 2. On the 14th of January, they've been to a restaurant called Hong Chong Tao at around 1 or 2 o'clock. We've identified another case who lives on the lower floor, 5E of Tropicana Gardens. There is a colleague as well as a preliminary positive case who's been there to eat. We now have a confirmed case who is the family member of one confirmed case. We traced the link back and found them. So there are 2 tables at Hong Chong Tao. They don't know one another, and they're both confirmed case. So we now appeal to people who've been to Hong Chong Tao to get tested. It's almost 2 weeks since the 14th. They won't be sent to the quarantine center, but we asked them to get tested. In Changshan Estate, actually it's a construction site near Changshan Estate. There are 5 workers and their family members who are confirmed case. The restaurant Hong Chong Tao was Cafe Med. For the workers in near Changshan Chun and their family members, they were picked up from the quarantine center. We found that there are more and more family members who turn out to be confirmed cases. We've identified an epidemiological link. One of the family members who's got a family member studying in Lee Chang Oak primary school is 13255. Who will be grouped under the Silka Seaview Hotel cluster, because someone who came back to Hong Kong and stayed at Silka Seaview, the family member of the 8-year-old studying in Lei Chang Oak Primary School. We've also identified some people living in Tung Chung, that is Coastal Skyline. A number of them stayed at the Rotunda at coastal guideline. According to them, every day there are about over 30 people playing football there. They don't know one another, but they know about 5 or 6. We've identified a number of cases who've been to that rotunda. For unlinked cases, there are 7. 13525, 40-year-old male living in Manshan Wukaisha village. We don't have details about the medical history. So far we can't find any link with other people. The other one is male, 26-year-old. Lives in Ngai Lang Hiep Wui in Tung Chung and wheelchair, is an occupational therapist. He lives in Chang Ning Building, Chun Cheung Center in Chun Wan. It's an unlinked case. He's been to the shopping mall where Eon is located, but he hasn't been to Eon. The other one is a 47-year-old male living next to the construction site at Victory Avenue. He lives at number 1 to 3. He walked past the site to go to work, but if he's never entered the site, we have to see if it's linked. There are 2 who works at the airport. One is a 67-year-old female, Baguio Cleaning Company, in charge of cleaning toilets at the airport. She's mainly in charge of the ground floor. We have to see. Well, she works in the midfield terminal. I think it is staff members' toilet, so we need to see if it's related to imported cases or something to do with her social life or where she lives. She lives in Wang Fuk Garden, Ting Yi. The other one who works at the airport, who lives in Taiwan House Estate and is in charge of security check at the airport. So we need to see if it's related to imported cases or someone living in Taiwan House Estate. Another one, male, 32-year-old, also working as a security guard in Taikushing. Lives in Namgay Daiha at Battery Path. The last one is a 72-year-old female living in Fukang House in Taiwan House Estate, not in Unit 2 or 3. Previously, there was one from the same unit. This case is a higher floor, a retired person. She's been to supermarkets, wet markets at Taiwan House Estate. It might be related to other cases. So that's all the report from me.
Good afternoon. By 9 a.m. this morning, in the past 24 hours, Hospital Authority got 139 reported cases. We've got 32 patients in the past 24 hours who have been discharged. So far, we've got 12,655 patients who've been discharged. And now we've got 578 patients at the Northland Town Hong Kong Infection Control Center, HA's Infectious Center, and Asia War Expo HA Community Treatment Facility, and 12 public hospitals receiving treatment. All of the patients are in stable condition. Thank you. So now is the time for questions. Before you ask the questions, please tell us which media outlet you're from. Who's first? This gentleman on the right.
Okay. With new cases identified in Kwai Chung Estate are now more linked to previous cases, or they were close contacts of previous cases. Do you think the outbreak there, especially in Yak Kwai House, has now peaked, and cases should go down very soon? And also, can you also explain that why officials have not stated whether the patients listed here are vaccinated or not? And final question to the housing department. There are complaints from residents in Kwai Chung Estate that the lifts are used to transport infected patients were not disinfected, and the testing arrangement is rather disorganized. So what will be done to improve this situation? Thank you.
I'll answer the first two questions first. So for the, we observed that the number of units has gone down to single digit. So this shows a decreasing trend today, but we still need to observe for a few more days. I mean, for Yak Kwai Lau, Yak Kwai Lau. For the other buildings, we still need to observe, especially for Ying Kwai Lau. I understand we are compiling the statistics for the vaccination and non-vaccination. We'll provide it in the today's press release. And for the other
Housing department.
Yes, regarding the complaint on the lift after transporting the infected patients. Normally, after transport of the infected patients, the lifts should be disinfected. And I think we shall reinforce our manpower to do proper disinfection in future. Thank you. And for the testing arrangement, normally before we start the testing, every day we have to confirm the address of the tenants who are confirmed positive or preliminary positive cases. And then we have to inform them not to go down to carry out a test. And after we've informed these tenants, we will start to do the testing. So the testing time will be different on different days. And we will orderly inform the tenants to go downstairs to carry out the test. Thank you.
Next question. This one, please. Dr. Chung, I'm from eMedia. I'd like to know that yesterday, HA said that there's one serious case. So by now, of the Omicron-infected patients, how many of them are in serious condition? Have there been any update in the number? And how many of the Omicron patients are asymptomatic? And of the discharged patients, on average, how many days do they stay in hospital? And what is the average length of stay in hospitals? Is it lower than usual? And also, another question, I'd like to know among the Omicron patients, how many of them have been vaccinated? And how many of them were actually vaccinated with Sinovac and Pfizer's BioNTech? And also, of the serious cases, how many of them have been vaccinated and with which vaccine? And for HA, in the press conference from now on, would you provide us from now on those figures with us from now on at your press conferences in relation to vaccination? Well, yesterday I reported to you in the fifth wave, we've got one patient who is in serious condition. And right now, the fifth wave is still developing, so we are still collecting data. So we've got what we've told you is the most up-to-date figure. As for vaccination, in our daily press release, there's information on that, but because of the new cases every day, so I think we need to wait for a few days before we can tell you the proportion and the differences in different age groups, because there may be kids who were too young to be vaccinated. So we need to do a proper analysis first. But so far, in our press releases, you might refer to what's on those press releases issued so far. This one? From Hong Kong 01. A reader in the Penny's Bay Quarantine Center who's the boyfriend of the colleague at Little Boss, and he was not discharged until 1 day late. And he called a hotline, but nobody answered. In the end, he was only asked to leave 1 day late. So there was also input error in the computer causing the quarantine people to be discharged late. What happened? Is it because of lack of manpower? How would you improve the condition, the situation, so as to avoid such administrative chaos? Would you offer compensation to the person quarantined? And also for cases, well, many cases seem to be related to toilets. There are 2 cases in Line Rise shopping mall. And in the Line Rise cases, did they remove their masks? And would you call on people when they are outside going to public toilets, they should exercise caution? And my third question is for other information. The 2 untraceable cases, the 47 male, where did he go to work? And the 72-year-old woman, which markets, wet markets or supermarkets did she go to? Thank you. The cases you mentioned, I don't have the information in relation to that, but if there's any computer input problem or error, I will apologize to the people affected on their behalf. And there have been no more cases, so sometimes there could be errors in inputting of data. It's possible, but of course we do hope that we would remind our colleagues to be cautious as much as they could. Sometimes human judgment is involved, and what you mentioned, the case that you mentioned, could be, well, the person affected could be close contacts of family members, and they were issued the quarantine order in a short period of time. And sometimes the close contacts could be asked to be quarantined for 14 days. But when the family member or the quarantine person was confirmed, then the quarantine order details on it could be amended. So that could be also one factor. As for public toilets, we're not sure about what happened because they went to the same floor in the Line Rise shopping mall, and the case concerned did not eat in the restaurant there. But the other person who ate in the restaurant went to the same toilet. So the only place where they could meet could be the public toilet because both were diagnosed with the Delta variant. So they could be related cases. All along, public toilets, restrooms, these are high-risk places because people tend to touch different surfaces, the handles and so forth, water taps and so forth. So people should clean their hands as much as possible, and after they've touched public surfaces, they should not touch their mouth, eyes, nose afterwards. The case at the airport, she is responsible for cleaning toilets, but that doesn't mean that she was infected in the toilet. So we need to look at the genome analysis to see whether it's related to imported cases or did she get infected in the community. So we need to carry out our investigation. It may not be related to the toilet itself. The 47-year-old man, where does he work, right? He worked at AIA Tower in Electric Road, number 183. The 70-something woman, which markets did she go to? Well, she told us that sometimes she go to Taiwan Estate Market. I found that many residents went to that market or Kwai Chung Market. She also went to Welcome, but that may not mean that she was infected there. It's just that, well, they tend to live in that area and they tend to go to nearby places. So there could be lots of possibilities for the infection.
I'm from Cable TV. I would like to ask about Yakwai House. There is a drop in number of cases. Does it mean that the transmission chain has been cut? Can you tell us whether the number of cases will continue to decrease? residents complain about testing. They can't make arrangements for those who are mobility impaired to get tested. Does it mean that you can't mobilize manpower to render testing services in their home? For lockdowns and testing, the objective is to try to identify cases during the incubation period. We see that the number of cases has dropped slightly. We hope that the peak has gone past us, but out of caution, we need to monitor the situation further. In relation to residents who are mobility impaired, we've been rendering assistance to them. Just now, as we said, that in certain circumstances, we will provide assistance, say, for example, pushing the wheelchair or giving them the support they need when they walk. But if someone can't go downstairs to get tested, the contractor will go up to provide the testing for them. The one on the left. I'm from Now TV. First, in relation to Kwai Chung Estate. First, yesterday the government extended the period of lockdown of Yak Kwai House. But today, Ying Kwai House, is there a need to extend the lockdown period? For Ying Kwai House, the queuing arrangement for testing and the taking of the lift, does the housing department think there is a risk of cross-contamination? Is there an inadequate manpower in place? I'd like to ask about Club Med. On the 14th of January, there are 2 cases who have been to this restaurant to eat. It's only today that you've identified a link. Does it mean that for these 2 cases, the incubation period is longer? What are the reasons is there to explain the fact that you only identified a link today when they went to the restaurant on the 14th? Did they sit close together? I'd like to ask about lower floor of Tropicana Gardens. Well, experts been there and they've decided the evacuation. Today, it's found that there is a risk of a transmission between blocks E and F. Does it mean that experts during their site visit have neglected to consider certain factors? Was it an inadequacy when they decided not to include the evacuation of Block F? Well, previously we know that for Club Med is someone working in Changsha Wan. It's not that we did not know. A lot of the patients are asymptomatic. We first found the family member of someone at a different table. We traced the link back and found someone who's preliminary positive. And then we kept looking and found that they've been to the same place. For the 2 groups, there might be some transmission within their individual group. But the 2 groups are not linked. We hope to identify the link between them. We investigated and found that the link might be Club Med, the restaurant. We're looking at the positions. We are still in the process of asking them where they sat. For Tropicana Gardens, it's a matter of risk management. Well, there is a vertical transmission at Block E. Of course, the safest way is to evacuate everyone in the same block, but we need to identify the distribution. At that time, they are all Unit E. We thought that that is a high risk. But for the others, it's not that they are not high risk, and they have to go through compulsory testing. Now we identified a case that is across the hall. Perhaps there was some kind of transmission across the hall. We've spoken to experts and decided that perhaps the scope should be expanded to other units as well. It's a matter of risk management. Housing Department. About testing, we've been monitoring the queuing arrangements as well as crowd management. If the queue's too long, we would inform residents to wait before they go downstairs. We would knock on doors or call them. We would tell them to come down to get tested at a better time. We aim at making sure that the queuing will be done in an orderly manner and there will be sufficient distancing. Next question. Sorry, the speaker is not using a microphone. The speaker is not using a microphone, the interpreter cannot hear. As I said, every day we confirmed with the Department of Health of the confirmed cases or preliminary cases. We then inform these people not to go downstairs to get tested, and then we'll ask the others to go downstairs to get tested. So the risk of cross-infection should be low. For confirmed cases, after they've been transferred out of the estate, we would step up the disinfection, especially in the lift, to reduce the risk of cross-infection. Next question, the one on the back, the lady.
MP. So as the number of cases at Yat Kwai House is still increasing, is it caused by cross-infection inside the building? And second, are there any problems in arranging hospitalization for infected patients? As an infected person told us that she had waited 35 hours since she was notified she was infected. Could you assess the transmission risk inside her household, because some of her family members were not test positive and they need to share the same bathroom? And third, how's the manpower at Yat Kwai House? How many workers are in the operation? And how is the division of work of different frontline staff? And whether whether you guys need more resources to address the problem of the delay? Thank you.
I'll answer the first question and followed by HA. So I think the number of cases in Yat Kwai Lau, the number of units affected decreased from double digit to single digit today. So hopefully there's a downward trend. So I think it's within our expectation.
For the fifth wave, you can observe that the confirmed case number can reach up to 100 in a day, and not counting those preliminary positive cases. This creates a lot of pressure to the hospital services. And actually, all along we have observed the situations, and then we have coordinated the service or bed arrangement between Hong Kong ICC, AWE, and also the coordination through the MICC. So once we receive the notification from CHP, we will immediately arrange the bed and to coordinate the admission for the suspected or confirmed cases. So in coming days, we will also transfer more cases, those who are more stable and in recovering cases, to be transferred to the AWE. So this can facilitate our bed availability for those newly admitted or those more need of a hospital service in our hospitals and also the ICC. So we will continue to monitor the bed occupancy situations, and if that is needed, we will mobilize more backup spaces such as our second-tier beds and also the AWE to admit more patients.
Housing Department.
Okay. Regarding the manpower in Yat Kwai House, I think in the past few days, we have deployed over 200 manpower to help in the food delivery, cleansing, security, hotline, and other actions, as well as the police force in ensuring the security and order in the estate. So different sections and departments have their own duties and responsibilities, and housing department as the coordinating department will coordinate with all the departments to discharge the duties. Thank you.
我想補充少少，今日有一
Supplement. There are 130 cases today, preliminary positive cases, which included more than 40 cases, of which 2 involve flights. One who arrived on January 25th, RA409 and EK384 arriving in Hong Kong on January 25th. It got more than 10 cases. This lady in the front. From Oriental Daily Press. Of the untraceable cases yesterday, Sham Shui Po, there were cases a few days in a row from January 23rd onwards. But how come overnight lockdown was only imposed last night? And Tokawai also only lockdown imposed last night. 13504, 13505, those are the case numbers. Are there many subdivided flats in those blocks? Are you worried about an outbreak there? And also, there's also a buildings department surveyor infected today. So is it an untraceable case? Where does he live? Who had he been in contact with? And also in Taiwan Hall Estate, more and more cases have been found. Do you think it could be the next site of outbreak after Kwai Chung Estate? And also, would you extend any lockdown for the affected or the lockdown buildings? What is your criteria for imposing a lockdown, overnight lockdown or what? I think Yat Kwai House situation has improved. Yesterday, more than 10 units were affected. Today, only 6 additional units were affected. So, it's from a double digit to single digit. I hope that it will continue to be on the downward trend. Case numbers are decreasing. Ying Kwai House, more 2 units affected, altogether 44 units affected. So we need to observe the situation. And just now, you mentioned the cases discovered from LTD, so they should be preliminary positive cases. So we need to look at the details first, afterwards. Yes, they were preliminary positive cases identified in the LTD. Two plus 2 plus 1. Two positive and 2 preliminary positive cases. The housing department staff who's infected. Do you have information on the case? Which estate is it? Speaker is not using mic. The buildings department maintenance surveyor who's infected? For individual cases of the hundreds, more than 100 of them, I can't remember the details of each case. In particular, if there's a serious outbreak, I would try to give you as much detail as I can. This one in the middle. RTHK, Chinese News. I want to ask for the untraceable cases. There was a 67 woman and also a there was also a Cathay Pacific passenger involved. What's her age? And there's also compulsory testing notices applied to schools. So would there be students among the new positive cases? And the Kwai Chung Estate, do you think there are signs that the outbreak is under control? And is there any chance of the outbreak extending to nearby blocks? And also for the housing department, how are you going to improve the arrangement for testing? Because every day, residents come down for testing at different times. How are you going to notify them? How about the disinfection, cleaning of the residential buildings? Is 37 women who worked actually at the Cathay City. For Kwai Chung Estate, we've been looking at the situation in the various blocks. In Yat Kwai, there seems to be a downward trend. For Ying Kwai, we still need to observe the situation further. The other blocks have not shown any obvious increase in cases. But you know, so many people live there in the entire Kwai Chung estate, and there are close contacts there. So when we discover them, actually, number of people have been infected. So they may have actually gone to work, go out to the street, go to work or study. So since Omicron is so highly infectious, so there's a chance of the virus spread in different districts. So we are worried that there could be various transmission chains in the community that we have not been able to identify, or people have been infected unknowingly. So I would appeal to the public to be vigilant. If you heard of cases you've been to that had cases, you should go for feeling unwell. You should undergo testing as soon as possible. In the front, please. Next one. Housing Department. For the testing arrangement, as I explained just now, every day our testing times varies. But no matter what, besides calling up tenants or knocking on people's door, we also see what other ways we can use to notify the residents so they can know early on when they should go down for testing. We'll review the arrangement again. And for cleansing, besides the original contractor, we've arranged for another contractor to help and provide a cleaning service. And they've also stepped up manpower to do the cleaning work. Every night, after dinner time, around 8 p.m. to 9 p.m., we'll arrange for cleaners to clean up the rubbish put outside various flats. I hope the situation will continue to improve. But I'd like to appeal to the residents to, in our designated times, take out the rubbish, usually around 8 to 9 p.m., take them out outside the flat so that our cleaners can take them away in one go. But the work involved will continue to make constant improvement to it. Next one. I'm from Dot News. There were 6 untraceable cases yesterday. Have you found any source for any of them? And also for the 5th wave, by now, how many untraceable cases have there been so far? And of the cases found, does it show that there are various transmission chains in the community? And how many silent transmission chains there are in the community, as far as you know? We have tried our best to find out the source of the untraceable cases. As I just reported to you some of those untraceable cases, like a KG5 student who lives in the coastal skyline, who played with other people in the public area. They may not know the people he played with, but they've been gathered there. There are some small kids who went to the open area as well, but you need to check the times, when and who were there. As for silent transmission chains in the community, it's so difficult to gauge because during the infectious period, every person, who might have been infected could be, active in the community, going to different places. Not everyone will stay at home. And we've noticed that it's really an infectious variant, highly infectious. Some people might not have, been infected through meals or conversations. The infected persons might have just happened to be in the same place at the same time. So I believe that there are a number of transmission chains in the community. If during the infectious period, if this case remain unfound, then there could be exponential growth in the cases, confirmed cases. Gentleman at the back. AM 730. For the Kwai Chung estate, in the past 2 days, residents have said that they saw on CCTV the lifts after transferring patients and rubbish. They have not been cleaned before. Other people go in and use the lift service. And just now, Housing Department said that they would step up cleaning, but we've seen footage of the lifts being used frequently. So are you going to hire designated people to man the lift? And for the cafe-backed restaurant, how are they related to the people at Unit 5E Tropicana Gardens? Now, the hamster at Tropicana Gardens tested negative. Then do you think the source is the pet or other sources? How about the latest development in the hair salon? How many customers have contacted you? And Dr. Chong just now mentioned various clusters like the Manning's Warehouse or Changshan Estate and so forth. Can you give us their case numbers?
I won't give the case numbers because there are too many of them. I just want to give you an idea that at certain occasions there is a transmission. This is just to draw your attention to it. I can't possibly give you the individual case numbers. There are two tables, for one colleagues and the other one also colleagues, but they work at different places. And as to the exact location of the tables, we don't know yet. For one table, there are 2 people, the other 3. For the 3 people sitting at the same table, 2 are confirmed cases and 1 preliminary positive. We are now able to link it with Tropicana Gardens because there's someone who's bought a hamster. And by a genome sequencing analysis, we found the similarities with Little Boss. Not exactly the same and 2 differences in SNP, but we think that it will be similar sources of similar location, but at the moment we have not found the exact location. For the salon, the hair salon, we have not identified any obvious source yet. In relation to cleaning and disinfection of lifts, the housing department has arranged staff to clean the inside of the lift, and for the buttons and a panel of buttons, they will be disinfected once every 2 hours. Well, there are different times for transference and clearing of rubbish, as well as distribution of food. They are done at different times, but sometimes we will need to do some cleaning immediately, and there might be some inconvenience. And it's not an ideal situation, but we will look into it, hoping to prevent a reoccurrence. The lady to the left. I'm from Mingpao. First, I'd like to ask about Yat Kwai House. We've received residents' complaints saying that someone has been tested positive on Sunday, but the person's only sent to hospital today, that is after 2 days. Family members, when they called hotline, was advised to go downstairs to get tested. And they are only asked not to go downstairs to get tested by neighbors because of risk reasons. How come that those manning hotlines don't know that close contacts should not go downstairs to get tested? Is it because of an insufficiency of manpower? People are very unhappy about arrangements in Kwai Chung Estate. People are afraid of cross-infection if they go downstairs to get tested. You are the housing department. Do you have any explanations? Would you proffer an apology? I'd also like to ask about the overall situation. For days, we see 6 or 7 unlinked cases. Where do we stand now? Does it mean that in a community the transmission is out of control and there are numerous transmission chains, and it will take a longer time to achieve that dynamic clearance? I'd like to ask about the 2 positive cases in To Kwa Wan. What other cases are they linked to? And for the Tropicana case who've been to Cafe Med on the 14th, can you give us the case number? I believe that there are quite a number of transmission chains in the community because there are cases showing a very unclear chain. say, for example, Victory Avenue, someone living nearby, is it really related to the construction site? Is it the case that the person get infected because he walked past someone else? And if that is the case, there should be a lot more cases in the community. There's also a chance that we have not yet identified these cases yet. So I appeal to you all that if you've been to certain high-risk places or you're not sure whether you've been, even if you are asymptomatic, get tested. And if you show any symptoms, say for example headache, sore throat, dry throat, please get tested as soon as possible. As I said previously, every day we need to first confirm the number of cases and the unit of confirmed cases. We will inform them to ask them not to get downstairs to get tested. Afterwards, we will inform other residents to go downstairs to get tested. In this regard, we'll call them by phone or go to knock on their doors. We will also explore other ways to inform them better. This is to let them know when they should go downstairs to get tested. Any other questions? Last question, the one in black. I'm from Economic Times. I want to ask about the CT value of unlinked cases. Are they Omicron or Delta? For the occupational therapist, when is the last working day? Any risk for the patients of the occupational therapist? And I'd like to ask the case number and CT value of the security guard at City Point. What are the duties of the security guard? Does it involve patrolling? If it does, will it develop into something similar to Kwai Chung Estate? If there are more residents being positive, would you consider a lockdown? There was one positive case in To Kwa Wan. As a result, there is a lockdown. Can you give us more details? For Chun Wan Eon, is there an outbreak? Does it mean they have to close from operation? 13525, unlinked suspected Omicron case. 13566, suspected Omicron. 13592, also a suspected Omicron case. 13612, also an Omicron suspected case. 13620, also a suspected Omicron case, and the other one is also a suspected Omicron case. I don't have the CT value at hand. And what's the other question? Eon. The staff members are in human resources, sales, and security. We've suggested to Eons to close for thorough disinfection. We'll also trace the close contacts. There are quite a number of members in the staff, so we need to see how many close contacts there are. If you've been to Eon at Tai Wah Hau, please get tested as soon as possible. I won't give out case numbers anymore because there are simply too many of them. I think it's a linked case. I don't have the details with me. That's the end of the press conference. Thank you. Sorry, speaker's not using a microphone. I don't have the information with me. I'd like to add, perhaps I made a mistake. We have not completed the genome sequencing for Tropicana Gardens.